Back pain. We've all had it, and if you haven't, doctors say you probably will at some point. But why do we get it? Well, one Topline MD Alliance affiliated physician, Dr. Lenny Sukenik, cracks it down to explain.
Lower back pain is one of, by far, the most common complaint that I see. And you know, I find that a lot of people get very confused about their back pain. It's painful, it hurts, they're upset about it, and they're looking for treatment.
But what exactly causes back pain?
The most well-known cause is what we call a herniated disc, right? A lot of people say, I think I have a herniated disc. It's actually not as common as sprains and strains. When you have back pain, it hurts a lot, and so you're not sure what you have. So the most common cause of back pain by far is going to be muscular. Strains and sprains, for sure, are going to be 90% of the back pains that we see in an office every day. You moved the wrong way, you twisted the wrong way, you lifted something too heavy, and you hurt your back. And now it's been hurting, and it's been hurting for a while. And that's usually what brings the patient into the medical practice.
So what are these different symptoms that can help you determine what type of back pain you're experiencing?
Let's talk about the difference between acute and chronic pain first. So acute back pain can last up to 6 weeks, and chronic back pain usually is back pain that lasts longer than 3 months. So that's our criteria that we use. Now, acute back pain is usually due to strains and sprains and muscle aches. How do we evaluate that? The most common way by far is physical exam. You go to the doctor, they examine you, and that's that. We don't have to go any further than that most of the time. Where we do use x-rays and MRIs and CAT scans, it's really saved more, not so much for the acute back pain, but more for the chronic back pain, or the pain that's changed, that something is different. But if you're having the most common type of back pain is pain that people describe as a belt wrapped around their body. And it's usually, and again, we're talking about lower back pain, so lumbar back pain is usually a belt wrapped around the body.
So once you've figured out what's causing and impacting your back pain, here's how Dr. Sukenik says you can treat it.
So the initial treatment is going to be heat. Heat helps immensely. A hot shower, a heating pad, a hot tub. If you can get into heat for 10 or 15 minutes, 2 or 3 times a day, on the specific area where it hurts, that will help immensely. The other thing you can do is anti-inflammatories. Advil, Aleve, Motrin. Over-the-counter anti-inflammatories work very well. Tylenol helps with pain, but it doesn't help with inflammation. So Advil, Aleve, Motrin would be better, but Tylenol will also help. And then there's a whole bunch of other medications we can use. There's topical medications that create heat on your back, and nowadays we have topical anti-inflammatories that we can use that are much safer over the counter.
But can you prevent back pain altogether?
You need to stretch. Stretching helps immensely. Yoga, Pilates, stretches at home to stretch your lower back out will help immensely. Sitting correctly, if you're an office worker, sitting at your desk makes a huge difference for your back and for your neck as well. And there are a couple of things that we can talk about when we talk about sitting at a desk, because I see this a lot. A lot of people come in having back and neck pain and they work at a computer all day long. They say, Doc, I'm not doing any heavy lifting. I'm just sitting there working. The 3 things that I tell them that I think is really important is, number 1, you need to sit in a correct chair. The chair needs to be at a very specific height so that when you put your feet on the ground and you sit on the chair, you plant your feet on the ground. And if you were to put a tray of marbles on your lap, the marbles wouldn't roll down or roll up, they would be flat. And that kind of gives you an idea of whether you're sitting correctly. This chair needs to have a back so that you can put your back to the chair. And when that happens, and when you plant your feet on the ground, what occurs is your spine locks into place and you're no longer using your muscles to hold you up. The second thing is to make sure that when you look at your computer screen, that your computer screen is at eye level. And how do you know? Well, when you're looking at your screen, if you were to draw an X in the middle of the screen, without moving your head, you should be able to look directly at the center of the X. And then the third thing is going to be to make sure that your keyboard and your mouse are at belly button level. So they're at the level of the umbilicus, which is your belly button, so that you're not reaching up or reaching too low. All of that would cause strain and sprain in your back and your neck. If you do those three things and you're working at your desk, you're fine. If you have a computer screen that's over here and your keyboards are over here and you're doing one of these, it's not going to be long before I'm seeing you for neck pain. And the same thing, if your chair is too high or too low, and a lot of us are now working from home, and so we're working at our dining room table, and that affects how I see a lot of people now who are working from home and never had back pain at work because they had the ergonomic chair and the computer system was set, but at home they're working on a laptop at their dining room table, and that causes a lot of pain. So you need to adjust yourself for that. If your dining room chair is too low, put some pillows underneath. If the dining room chair is too high, get a footrest for the chair. If the laptop is too low or too high, adjust, put some books underneath it. Do some things that'll help you out. You'll find that'll make it immensely easier for you to work. Your productivity will go up and you won't hurt at the end of it.
How can you tell the difference between treating back pain at home and when you actually have to go see a doctor?
If the pain doesn't get better, it's worth it to get evaluated by your primary care doctor. You don't need to always go to orthopedics, and you don't always need imaging studies. You don't need to get an MRI or a CAT scan every time you have back pain. The MRIs and CAT scans are really, and x-rays are there to tell the doctor what the next step is. If we're worried about something, that you have a herniated disc or that it's more than just a muscle strain, that's when it's important to get imaging. But if it's not, imaging is not worth it. It's not necessary at this time. Treating it is necessary. Treating the pain.
To learn more about how to control and determine your back pain, visit toplinemd.com. Plus, if you don't have a primary care physician, all of the affiliated doctors' information can also be found on that page. The Topline MD Alliance consists of a group of top-of-the-line medical physicians and care teams who are committed to an exceptional patient experience while helping them to coordinate their care.